internal and external stakeholders, and indeed our partner in CNW, to understand and appreciate to the extent that I am sure they do, but even more so, how important this initiative is. This is game-changing. This has the capacity to heighten customer service, heighten the delivery of that service, heal more people in shorter space of time, and so have greater throughput into the system, which will reduce, hopefully, the long waits that are characteristic of our public health infrastructure over so many years. So that's a vision. And where we are now is that we are now at the implementation phase of that vision. It took us a long time. I mean, Stephen, unlike the private sector, government don't work that fast, right? The bureaucracy associated with decision making, in the interest of transparency and accountability and all the other things that are necessary for taxpayers to be satisfied, oftentimes leads to significant process time to the point where we can get some tangible results on the ground. And we have traveled that journey. But I do believe that this ICT infrastructure project, as part of the health system strengthening program, which is the title of this BP-GOJ partnership, which we intend to make a fundamental shift in what we offer, is timely, it's appropriate, and I dare say in light of COVID, it was a time that has come, and even before COVID, we anticipated that this would be necessary. The value of this project is $8.43 million US dollars, not Jamaican dollars, right? Put the US in front, make a big difference, right? That's well over $1 billion. And the project is intended to look at storage. This is the hardware side, servers, backup, disaster recovery, as well as network and workstations, cybersecurity, and help desk support. And it's not an infrastructure setup that is going to be in 2 or 3 facilities. I dare say, which is significant, it's going to be located and networking 150 facilities. I think we deserve a round of applause for that. What do you think? All of us that is in, right? Because the team has done a lot of work to develop the program. But 150 health centers will benefit, and our hospitals. So it's a process. We're going in phases. But this is sufficiently significant to make a difference, to have an impact, to demonstrate a pivoting for the better of the policies and the programs that we have to implement. As I said earlier, it's timely in light of COVID, because COVID has taught us one thing, if nothing else, that healthcare post-COVID can't be healthcare pre-COVID. If there's nothing that comes out of the COVID experience, it is that we have to take out of the crisis the lessons that COVID has taught us in terms of our capacity to respond to a threat that disrupts our society in almost every single area. In the past, some people felt that you could place in a silo healthcare provision and everything else can function because health is not as important except the individual personal experience, which you either have it or you don't, or you have to wait for it. I think COVID has said to us and is saying to us, and those who have eyes to see will see and ears to hear will hear, that every aspect of life, economic aspect, social aspect, socioeconomic aspect, is impacted by a health threat. And COVID came suddenly and has wreaked havoc on our society and has changed life as we know it, at least for the past year and a half. Lockdowns and restrictions and work from home and overcrowded hospitals and oxygen run out and death and despair and mental health issues, we have to now engage almost in a process of recalibrating how healthcare is, in the first instance, perceived. Because if we don't recognize as individuals, and then from the bottom up to policymakers, that we have a vested interest in preserving good health systems, from prevention through to cure, then we have a problem as policymakers implementing it. So we have to start with that. And what COVID has also and should also teach us is that we have to adjust our thinking in terms of how we manifest that in terms of what we offer. And it is a little bit of luck, but a lot of, I think, vision and foresight. And I'm not claiming credit for it. I think the government of the day made commitments when it sought political office, and we sought to live through to that. So it is collective, and the people in their wisdom supported that vision. That's the nature of our democracy. But it is good that we actually started on this journey before we are where we are. So we, in a sense, have an advantage. We must view what is happening here today almost as a head start. And we must take advantage of it, utilize it, and give it
vision and leadership. Also, our gratitude to Mr. Price and his team for taking the time to be present here today, and importantly, for the clear commitment to ensure efficiency, sustainability of the improvements to the ministry's ICT infrastructure. To the hard-working project team, Mrs. Frit, Mr. Bolton, Mr. Maraj, and others, Mrs. Suarez here, and the entire team of the Ministry of Health and Wellness who work tirelessly to boost the capacity of the public health system for us to deliver the highest possible quality of care, including today's important milestone. You too have our thanks. We're indeed grateful to every person in whatever way, small or large, who helped to make today's event possible. I thank you all for your contributions and continued cooperation to work in the public health